Hi everyone, my name is Paige Greenewalt. I am in the RN to BSN program, and today I am providing a presentation for Nursing 410 Issues and Trends in Nursing. This presentation will focus on building strong nurse-physician relationships and explaining why they matter in the healthcare field. Nurse-physician relationships are extremely important to enhance collaboration, communication, and to better patient outcomes. At the end of my presentation, the learner should be able to do the following. Identify 3 key factors that influence effective nurse-physician collaboration. Analyze the impact of professional relationships on nursing practice and patient outcomes. And be able to apply 2 evidence-based strategies to strengthen nurse and physician teamwork in the clinical setting. So, why nurse-physician relationships matter? Effective collaboration is critical for both safe and high-quality patient care. Poor communication has been proven to be the leading cause of medical errors and burnout among healthcare professionals. Fostering an environment of both mutual respect and understanding helps to ensure job cohesion, job satisfaction, and better health outcomes for all who are involved. So, what kind of influence do these relationships have on nursing practice? Well, positive collaboration equals improved clinical decision making and autonomy among nurses. And nurses will often feel more valued and more likely to engage in leadership roles or to voice their concerns. Poor relationships often cause issues such as conflict, distress, and an increased turnover rate among physicians and nurses alike. So, what kind of impact does this have on the healthcare system overall? Well, healthy and collaborative relationships help to promote patient safety, reduce hospital readmission rates, and improve care coordination. It has been proven by multiple studies that hospitals with strong interprofessional collaboration do report lower turnover cost as well as reduced medical errors. So, what kind of impact does this have on the society and patient outcomes? Well, first, it is important to note that in today's fast paced environment, nurses and physicians must rely on strong communication and trust. When relationships begin to break down, patient safety and staff morale begin to suffer. Patients have a sense of trust in the nurses and physicians alike. Oftentimes, if patients do not believe that their nurses and physicians trust one another, they're often not going to trust us to be making decisions about their medical care. Overall, healthy nurse and physician relationships lead to a healthier population and an efficient use of healthcare resources. So, what can we do to improve on nurse physician relationships? First, it is important to note that nurses often act as the bridge between physicians and patients in communication. So, when collaboration is strong, the patients and nurses will feel more empowered to advocate effectively for themselves, leading to safer care delivery. I believe it is important to implement interprofessional education training programs, as they have been proven in multiple different studies to help with active listening skills and clear and concise documentation. The use of the SBAR format for clearer communication is also extremely important. SBARs stand for Situation, Background, Assessment, and Recommendation. This type of format allows for the nurses to clearly document what they need from the physician and for the physician to respond appropriately. Joint rounds and team huddles are also extremely important. This can help ensure that the physicians and the nurses are present at the same time and can voice their concerns in a timely manner. Promoting a culture of respect and safety in the healthcare settings is also extremely important. So, what are we going to do to better these relationships in the long run? It's important to note here on this slide that professional relationships are foundational to quality care. These relationships help to enhance nurse satisfaction, patient safety, and system efficiency. So again, fostering an environment of mutual respect and open communication can transform healthcare. It is important to note that it is not an option to improve these relationships in the healthcare setting. It is essential for the future of healthcare and can help the communities and families trust providers and the healthcare system more. And these are the references and the studies that were used to create this information. Thank you for listening.